can be done to uplift primary care is to increase the proportion of post-graduation seats to primary care specialization. If you see US, they allocate approximately around 50% of the post-graduation courses are allocated to primary care specialties. And these include family medicine, internal medicine, primary care, and also primary care pediatrics. By the term, we mean primary care, internal medicine, they can further specialize so that they have a pool of generalists who can treat, who are also a qualified postgraduates who can treat a variety of illnesses in a uh, primary care or a secondary care setting. And also, one of the other things which we can do to improve primary care is to bringing in a lot of primary care centers and community health centers and district hospitals as a training center for the post-graduation course in primary care specialties. So what we right now the DNB training in India, they are carried out mostly by the hospitals, which are corporate hospitals. Certain missionary hospitals are also there, and certain government hospitals are also there. But the idea is that the family medicine should be practiced in a community setting. Okay, and by bringing primary healthcare centers and also district hospitals as a training center for family medicine graduates, this will create a lot of opportunities for them to excel in treating variety of illnesses, and also it will also uh, uh, help in improving the doctor population ratio in rural areas and semi-urban areas. So that if we have 3 years of specialization in family medicine in all these centers, primary health center, community health centers, so we'll have a pool of doctors who are already rotating for a long time. And after that, once they finish their training center, they can continue to practice there, or they can relocate to their native places. But once they relocate, we'll have a fresh batch of family medicine trainees who will be coming to the community health centers. So that there's always, there's a supply of postgraduates who are trainees in family medicine. And also, if these primary health centers and community health centers, uh, they have opportunities for working. If they create opportunities for family medicine postgraduates to work in that, who are qualified family medicine physicians, this will also improve the academics in terms of managing patients, and also they'll have a mentor. All the trainees will have a mentor who would be supervising their work in these centers. So right now, the focus should be on the primary care centers and improving secondary care centers in addition to medical colleges. So what happens is that a lot of emphasis is given on the medical college and tertiary care. This has invariably resulted in, I would say, like less importance in primary care setting. So that's why the government has planned, which I discussed about the pyramid. So as described in the previous slide. So what the desired direction should be from 2025 onwards. So that's what once we uplift the primary care centers, we'll not only have a good healthcare outcome, but we'll also have a lot of qualified, trained, and experienced family medicine graduates from these training centers. And also, last couple of points are left, which I'd say incorporating family medicine as a subject in undergraduate training is very important. So a lot of students are not familiar with this concept of family medicine, and they come to know only after they pass MBBS and give an NEET exam, and they come to know that there is something called DNB family medicine that's available for taking up as a postgraduate course. But yeah, because this has happened because the family medicine as a subject is not incorporated in the undergraduate training. And also in many medical colleges, there's no department of family medicine. Okay, only certain medical colleges in India, they have a department, established department of family medicine. And for example, the Calicut Medical College or St. John's Medical College, and even AIMS have started with family medicine program recently. So, and many other government and private institutions, they still don't have a department of family medicine. So that's one of the reasons why the undergraduates are not familiar with the subject. Whereas if you see in the US, UK, other areas, there's, family medicine is part of medical college department, but they are usually established in the community centers like a county. So they are establishing a county, so they cater to a set of population. So and they work with the university hospitals, but however they have the centers at the peripheries. So what we can do is like we can incorporate family medicine department in medical colleges, and maybe the concept can be uh, carried over to the semi-urban and rural areas where we can have a set of population assigned to the family medicine department. They can cater to the population. Right now, community medicine departments are doing a good job in terms of primary care in this area. So I would suggest like good what do you call collaboration between family medicine and community medicine in terms of improving the primary and secondary care centers at the periphery should uh, uh, improve the upliftment of primary care in India. And also, last but not the least, there should be increasing research studies towards primary care. So right now, the things are improving with respect to research towards primary care, but the problem is behind funding. So the government should realize and increase the funding towards primary care, which can be either it can be in rural setting, which can be in urban setting also. But that emphasis should be on increasing the scope of research, not only in the scope of research, but also funding the research. These are the important points which can be done to uplift primary care in India. So coming to the most important slide of this topic, why family medicine is important in healthcare. So as I said earlier, majority of illnesses, whether it's common or if it's rare, if you have expertise to treat, health checks, that is preventive health care. So in terms of screening for cancer, screening for non-communicable illnesses, all these can be dealt by family physicians after good training. So suggesting and practicing preventive measures, and also certain chronic conditions like non-communicable diseases like diabetes, hypertension, and also having a regular follow-up of those patients would result in avoiding complications related to those non-communicable illnesses. So that would eventually reduce the burden on the tertiary care centers. So the focus should be on how to minimize the complication or how to avoid the complication, so that the admission the patient does they don't arrive at the state that we need hospital admission. So we need to focus more on preventive measures in order to curtail an illness at the primary or secondary care level itself, so that the patient they don't land up in complication which would eventually burden the tertiary care center. What by this method, what we are helping is that we are helping the subspecialists so that they can focus more on complicated illnesses that need specialist intervention. So right now we do see a neurologist treating a migraine, whereas a migraine can be treated in a primary care setting itself. So and right now, like migraine can be dealt by a family physician. So we don't need a neurologist to treat migraine. So we don't need a neurologist to diagnose and treat headaches. Whereas we do need neurologists in terms of managing stroke, which are complicated. We do need neurologists in terms of certain advanced treatments like for Parkinson's disease. There's something called deep brain stimulation. The neurologists, they have an important role to play. But with respect to common illnesses like a migraine, which is easily diagnosed and treated in primary care setting, don't need neurologists. So by this method, we can actually we can reduce the burden on super specialists so that they can concentrate more on complicated illnesses. And also, single family physician can cater to a set of population. So right now, the WHO recommends the doctor and population ratio of 1:1,000. In India, we do have a good number, that is 1.34 to a population of 1,000. But where are these doctors? So these doctors are usually, they end up in preparing for entrance exam for long time. So they take years to prepare for the entrance exam, and also they work as a duty doctor in various hospitals. So that's what I mean. The doctor and population ratio in terms in reality, if you see, it's actually more than 1:1,000. So it could be either 1:1,400 because of these lacunae. So a lot of MBBS graduates, they are still preparing for years to crack an entrance exam, and or also they are working in as duty doctors in various hospitals. So this can be avoided if we focus on uplifting and educating them in terms of family medicine and primary care specialty, so that we do have a good trained doctors to population ratio who can cater to the set of population. And also, family medicine is important in terms of coordinated and comprehensive healthcare. By coordinated care, I mean that there is definitely good coordination between family physicians and the hospitals whom they are referring the patients to. So the coordinated care will involve both the community healthcare centers and also the tertiary hospitals which are attached to the community health centers. And by this coordinated care, there should be a good rapport between family physician and specialists who are taking care of their patients. This coordinated care can also be extended to the tertiary care settings, where if the internal medicine hospitalist or a family medicine hospitalist, if they are coordinating with various specialists, they eventually lead to better outcomes of the healthcare of the population. So this coordinated and comprehensive, by comprehensive care, we mean taking care of both physical, mental, social, environmental, and spiritual health care of the patients. So, and it could be done by a family physician to a wide range of patients. And also by this coordinated and comprehensive care, the resource utilizations is well channeled. And also the healthcare expenditure, if you look overall, can be minimized by this concept of family medicine, by concept of coordinated and comprehensive care, and also by having a proper system that the first point of contact should always be a family physician rather than burdening the tertiary care hospitals. So all these methods will eventually lead to upliftment of healthcare in the population.